Most people with back, butt, and sciatica pain have been led to believe that deep squats or squats in general and disc problems do not mix because, God forbid, you round your back, you might squeeze the jelly out the donut or set yourself up for more of an injury, right? Not always the case. Many people with disc problems hate standing and walking, but they love sitting, which tells you they have a preference for rounding their back. And this case is no different. A gentleman with 2 years of disc problems tried all the Cobras, bird dogs, fancy stuff like that he should have been doing, but we actually found that deep squats were the movement that he needs to use as medicine to resolve his pain. So in this video, I'm going to show you exactly how we bottled up deep squats as a medicine. We optimize the movement prescription and use it to resolve his pain, and potentially it works for you as well. So if you've tried all the normal stuff and it's just not working, my name is Dr. Charlie Johnson. I'm a physical therapist. I have my orthopedic board specialty, and we help people like you all around the world dealing with back, butt, sciatic problems learn how to take a different approach to get a different result and heal naturally. Oh, and by the way, if you're interested in determining the cause of your problem, go ahead and download my Better Than an MRI DIY diagnostic guide above.
Yeah, so basically, I'm a firefighter, so my job is very physically intensive.
Yep.
And it is kind of weird. So I herniated my discs. I herniated a couple discs, and then it's been a slow path to recovery. But when before I started your program, I was taking like 5 a day, and now I don't really have to take any.
That's good, man.
Every
That's
now,
what's supposed to happen.
yeah, exactly right. And so I'm grateful for that.
Sure.
One of the things that I'm curious about is like I kind of go through, I don't want to say it's like a cycle, but it's like I'll have like flare-ups, but they're not like bad. Like I could still, like for instance, I had a flare-up yesterday, but I
Uh-huh.
still walked like because I do 10,000 steps a day, and so
Mhm.
I still like walk like 2.5 miles even with a
Okay.
flare. So they're not bad. Like
Yep.
I can still do it. It's just annoying.
Hmm.
And so something that I've kind of recently discovered is when I do a leg day. So I'll do like a lot of body weight squats.
Yep.
And when I do leg day, that kind of actually tends to lower the pain or
Good.
get rid of the pain. I don't know if it's the adrenaline or if it's like getting rid of the inflammation. I don't actually know.
Hmm.
And then, but it seems to be that when I move more, I feel better. When I move less, I feel worse.
Yep.
And the other thing would be that, yeah, I just don't know if like I basically I don't know how much I want to jump into like
Hmm.
what is it? Because I was a very active guy before I got injured. So I
Yeah.
like,
Yeah.
climb mountains, hiking, wakeboarding all the time, like snowboarding, all the stuff. And
Yeah.
so I don't know how like should I take it like a little slow or should I just dive right until I like hit a wall? Because I don't want to like end up back to where I was.
I want to highlight your first point. All right. So your first point was that you go to the gym and you enjoy doing squats. You do some body weight squats and you actually feel better after doing the squats. Is that accurate?
Yes. Yeah.
Good. Okay. Now, why? You have to be able to answer that question.
Well, it could be, yeah. So it could be a couple of things. It could be that I'm just using that muscle that I haven't used basically in a year.
Hmm.
It's because I got hurt about a year ago. It could be like an adrenaline dump when I'm exerting myself, or it
Hmm.
could be that because it's not like temporary. It kind of the relief lasts for maybe a few hours to the rest of the day. So I'm thinking that it might be actually the inflammation like
Hmm.
going down in
Okay.
some capacity.
Yep. So I'm gonna flash something up here in a second. Let me do this. So I'm gonna pull up your healing log. All right. So let's make sense of this. So you've got multiple pain triggers: standing, walking, running. All of these things which involve you being upright. Does that make sense? Is that clear? So
Yeah.
standing, this is a position, right? Walking, this is a position your legs are kicking back and doing whatever, right? Running, kind of like this as well. Um, and so if we draw this out, okay, so your yucky motions are or were mostly standing, walking, running. Yucky. And so now we ask ourselves, well, what about those things would be common from a movement kind of pain relationship standpoint. And it would all be the fact that those are more, if this is you, they're more involving you kind of being in this extended upright position. All right, in this position, you get that? And so now the opposite of being upright or extended would be some type of flexed, which would be this. And that would also be you doing body weight squats. Does that make sense? And so it's quite possible that you're just chewing on, if we think of movement as medicine, and that's a movement pill, and the movement pill is a squat, that you're just chewing on that yummy movement pill and for enough reps to where it reestablishes safety mentally and physically. And maybe it, sure, you could say, well, maybe it reduces the inflammation. I'm not going to go so far as to say that, but regardless, it's a motion that feels safe. And my guess is if we were to test it, immediately improves the yucky motion, immediately improves the yucky activity. And you kind of already told me that. Right? So if we wanted to prove that, then we could test yucky motion. Then we could treat using yummy motion, squat. And then we could retest yucky motion and we could see if it's same, if it's better, or if it's worse. And we could prove it if we want, but I think you've already done so. And so if I were you, what I would be doing based off what you've told me is I would say, how can you take this motion that you already know is safe and already, for reasons we talked about, most likely, now it's a little bit theoretical based, right? Okay, this is a problem, and so you're reversing that or whatever. It's a little bit theoretical based, but how could you take that thing and then how could you bottle it up and use that thing as medicine? And so now we do is we say, all right, we're not just going to do that, 3 times a week. It's like, well, what if we could do, 3 sets of 20 body weight squats a day, for example? Now I'm making that up. Maybe that's not optimal or maybe that's not best for you, but we would we would bottle this up. We'd stick it in there. So here, we'll do that. We'll stick it right in here. You went to the pharmacy and that's your movement as medicine. It's a little squat thing. And it says how much? It says, let's snack on the movement pill even more. So we're going to do 1 set times 20 reps. So just 20 reps, 3 times a day. And then when are symptoms at their worst? I know they're not as bad as they were for sure, but when are symptoms at their worst in general?
It'd be in the morning, yeah.
Good. So what we would do is we would do this like in the AM, right? So we would chew on this pill immediately once we got out of bed. That would be our warm up, right? So we could technically you could say, well, how could I do this? This is your little squat. How could I do this in bed? Now that's one way you could think of it. If you want to do it even before you get out of bed, you could just say, well, I'm going to do that and I'm going to turn it on its side. I'm going to do I'm going to do a knee to chest, a knee to chest, a knee to chest. We could prove that or disprove that. It has not been proven yet, but what has been proven is that a loaded squat body weight, according to at least what you're telling me, seems to be safe, doesn't make things worse, and in fact makes you better for potentially the reasons we described. And so I would, when you say morning, just right when you get out of bed, it's super yucky, or is it, what does that look like?
Probably the worst is when I get out of bed and then it kind of tapers down. The more I move throughout the day, it seems like the easier it is. Like we'll have during Veterans Day, it was a holiday. So I didn't really have to work much at all, and I could tell that I was in pain a lot longer into the day than normal.
Yep. So I'd be then saying, if I know movement in medicine in general is helpful, but even more so, I know these squats seem to work. And by the way, they don't just work for like half an hour. Like they work for maybe the whole day, which is awesome, or for quite some time. That I'm seeing how often can I snack on this thing? Maybe it's not 3 times a day. Maybe it's 1 set of 10 reps and it's, 6 times a day, right? So we did 3 sets of 20 reps, that's 60, or we could do 10 reps 6 times a day. And so now what you're doing is this. You're constantly keeping, if this is pain and this is time, you're constantly keeping this medicine in the system, right? To keep things down. Now, look, this is not the long-term goal. I'm not saying you do 60 body weight squats every single day for forever. But if you're trying to use movement as medicine, the goal is never to take more medicine than needed. It's to take as little as necessary or little as possible to get the maximal therapeutic dose. If we know we can do 10 reps as your symptoms maybe are a little bit yucky and we just get it down, and then if symptoms climb a little bit, boom, and we can just keep taking this medicine throughout the day, that might even be a little excessive, 6 times a day, but maybe 3 of them are in the morning. Right when you get out, 15 minutes later, another set, 15 minutes later, another set. In the first hour, you've done 30 reps. And then you space them out accordingly throughout the day, that type of thing, the remainder of the day. So you see how you can kind of time when you would take the pill as well. So maybe we kickstart it when symptoms are high with these squats, boom, 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 in the first hour, and then we can take it, and then we can take it, and before you know it, you're creating an environment using movement as medicine that is conducive to you being just less irritable at all times. And then the less irritable and the less sensitive the nervous system over time, then you take the compound effect. And before you know it, you say, okay, I don't have any pain. So that is the idea. So there is a means to an end to this, but this is how I'd be thinking about it just based off what you told me. Does that make sense?
Yeah, that's clear.
Cool. Movement as medicine. All right, so hopefully this video is valuable and really shifted your belief system about what you should do or you shouldn't do, or what's good or what's bad. No such thing exists. It's really about choosing your own adventure and finding via testing, not guessing, what's gonna work best for you. So again, if you've been diagnosed with a disc herniation and you're looking for a natural solution, you're interested in taking a different approach so that you can get a different outcome rather than just doing a cookie cutter sheet of exercises, click the link below to apply to work with us and submit details of your specific case so that I can review your case personally. Thanks so much. Let me know your thoughts too in the comments. Were deep squats helpful? Did you test them out? What happened? Thanks.